Hello, this is Dr. David Green, CEO of the Georgia Pain Network. Today's topic is an overview of medial branch blocks. Back and neck pain in the U.S. is rampant. It affects 90% of Americans at some point. Back pain is the second most common reason people see a doctor behind the common cold. It's the leading cause of disability in those under the age of 45. Up to 40% of those who undergo back surgery are unsuccessful, and the cost of neck and back pain in the U.S. exceeds $100 billion a year. Now, when you look at the joints of the back and the neck, they're small. They're about the size of a thumbnail. There's one on the left and the right side at each level, and they're called facet joints. Okay. Now, the disc itself is the source of back pain 40% of the time, but the facet joints are the source 45% of the time. They do have cartilage. They're prone to arthritis, and they may be small, but they can cause big-time pain. So when you're looking to diagnose the source of a patient's back or neck pain, history, physical exam can help. Imaging studies can show arthritis, such as you see here. You see these joints, that's a joint, and that's a joint. It looks kind of ratty and bony overgrowth. Whereas here, you don't see any bony overgrowth, and the joint looks pristine. So you might see that, but it doesn't always correlate with how much pain the person's going to have. So a medial branch block, we'll start by looking at the medial branches themselves. This is a nerve root coming out from the spine. That's not what we're talking about, okay? We're talking about little nerves that come off of the nerve root called the medial branches. And this is what they are. This is a facet joint here. And basically you have the medial branches supplying sensation to that joint coming up and then going down to the joint below. All right, so it has a dual purpose. Sensation up, sensation down. No motor function at all, just sensation. Now, when you're blocking the medial branch nerves, you're basically injecting numbing medicine and possibly some steroid around those nerves to stop the sensation so the brain doesn't get those pain signals. Okay? It's performed for two reasons. One is diagnostic, to say, the pain doctor can say, is this the joint that's causing the pain? If the pain's relieved from the block, the answer is yes. It's also therapeutic because the pain relief from that injection can last for months. This is an outpatient procedure. Patients don't need sedation for this. It takes under 20 minutes. Now, the diagnostic part helps pain doctors figure out if the joint is the source of the pain. If the injections work well and then it wears off, you can either redo the medial branch block or go on to a radiofrequency ablation procedure that can be performed and give 6 to 24 months of consistent pain relief. Now, the therapeutic part of a medial branch block shows that on average, pain relief is over 3 months duration. The procedure works well in 85% of patients, and a repeat procedure works just as well. Now, if the medial branch block wears off, it can either be repeated, or the patient can go on to have a radiofrequency ablation. So the catheter is put in the same position as you would for a medial branch block, but instead of just injecting the numbing medicine, it actually gets heated up and deadens those little nerve endings, and that can provide pain relief for 6 to 24 months. The top non-operative pain management in Georgia is through the Georgia Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options such as medial branch blocks. Visit us online today at georgiapainnetwork.com and then call us for more information and scheduling at 404-850-9099. I'm Dr. David Green with the Georgia Pain Network. Your pain stops here.